Okay, this is for the rebuttal for deliverable 3, diagnostic procedures for reproductive disorders. Very interesting case. We had a 32-year-old female. She presented with complaints about heavy menstrual bleeding for about 4 months, and differential diagnosis for this case were actually constructed, of course, by using the Palm Coin framework. So the PALM, looking at polyps, adenoids, gliomas, malignancies, hyperplasic type issues, and of course we wanted to rule out fibroids with that section, and then the COIN non-structural causes, looking at coagulopathy, ovarian dysfunctioning, endometrial functioning, the idiogenic, possibly iatrogenic possibilities, and we're not yet classified. So as always, because she's a 32-year-old female, we did have to rule out any possible pregnancy, because that would be our history with our safety measure. So it's our priority. So of course we ruled that out right away with the patient, so that was not a possibility. And then looking at the differential diagnosis, she did have gliomas or fibroids supported by her, possibly because of her enlarged uterus, and then she had some pelvic pressure as well. And she also had a family history with fibroids. Her mom had those, so that is a very possible differential diagnosis for her. And it was positive through her assessments with the enlarged uterus and the pelvic pressure. Second, we looked at ovarian dysfunctioning because of the irregular cycles, irregular timing of those cycles, to make sure that polycystic ovarian syndrome was not a case. Third, endometrial hyperplasia because of the prolonged heavy bleeding. Fourth, endometrial polyps because of the irregular bleeding pattern. And then, of course, a lower, because we had to rule out pregnancy. Of course, that's always our first priority, but that was lower on the differential diagnostic list that we had. Thyroid dysfunctioning, of course, was 6 because of her menstrual irregularities, and then coagulopathy. She had no history, genetic factors, or lifelong history of bleeding. Sorry, I'm tired tonight. So basically, the follow-up and clinical summary reasoning is complicated for her because it was the overlapping presentation between the structural fibroids, the uterine enlargement, and the functional ovarian dysfunctioning with her irregular cycle, her menses cycle. So as always, the diagnostic strategy, of course, safety first, rule out the pregnancy, and look at the severity of possible anemia, because she had been really soaking through quite a few pads. The greatest time was like between, I think, 1 pad every 2 hours. So if she continues to do that, then we would want to look at her relatively sooner than the follow-up of 2 to 4 weeks. Actually, we did do a transvaginal ultrasound in office, and actually did do an endometrial biopsy as well. It was the first time I have ever seen either of those, so it was quite interesting. So we're waiting for those to come back as for her next appointment. Her pregnancy was negative, and actually her hemoglobin did look okay at 8.2. So we know that so far as well. So definitely a confusing case because of the possibilities, and hopefully we'll find out what actually transpires out of the case. That's it. Have a good night.